Hello and welcome. I am Ashok Rajguru, your instructor. Today we are taking case number 8 from Dr. Ashok Borkar's book, Pathology Factor in Remedy Selection. The title of this case is A Case of Systemic Lupus Erythematosus. The objectives of this course are as follows. We will develop an understanding of the pathology of this condition described as lupus. This will help us in determining the hierarchy of symptoms, because unless we know what are the symptoms of the disease, we are not in a position to find out what are the individualizing symptoms of a patient. Also, this particular case will illustrate the importance of repertorization, case analysis and case synthesis over the current popular trend of the sensation method or the other new methods. While those methods may or may not succeed, the objective of this particular presentation is that conventional, traditional methodologies of homeopathy are quite capable of selecting the correct remedy with fewer pitfalls. We will also do a differential analysis of the remedies that come up during our repertorization to zero in on the correct remedy and also help us to have a strategy for the second prescription. Another point that will be emphasized during this presentation is, in the later videos, how a disease name can mislead. And very often, allopaths will send their patients to homeopaths with a disease label based on insufficient data or unreliable data. So that is one thing we must always be wary about. Very briefly, this is the case of a female patient who is 40 years old and is presenting with the following symptoms. Of course, I presume you have read the attached document and gone through the case in detail. It is very well presented in a conversational form with very good critical comments by Dr. Borkar. So please read the case before you proceed any further in order to get the maximum benefit out of this presentation. So this particular patient, who is a female patient, 40 years old, has been having a history of intermittent fever for the past 2 months. She has pain in the ribs, and overall she is having pain which she has described as a bruised or a beaten feeling, as if she has been beaten with a blunt instrument. Also, there is swelling on the dorsum of the foot, and it has a black discoloration, and it pains when it is pressed. There is also pain below the elbows with black discoloration. The patient also says that she has a mild headache, which is better with her eyes closed or in darkness. Further, there is back pain, which feels better if she is supporting it, and once supported, any motion or movement aggravates the pain. She also has some dreams repeatedly of ants or lots of hair falling on the ground, which she considers as a bad omen. Now, I'll just briefly go through the comments made by Dr. Borkar. Dr. Borkar says that this particular case is difficult to solve with the help of rubrics. And that was why, or that was perhaps the principal reason why he tried to steer the case taking to elicit a particular sensation or to follow the sensation method. The purpose or the objective of this presentation is that one need not actually digress into that particular path, and rather one could have concentrated on a more conventional approach of classical homeopathy and tried to elicit something more about the modalities and such other features which help us in repertorizing the case. What Dr. Borkar says is that this case is difficult to solve with rubrics, and hence the sensation approach helps in such cases. The principal sensation is that of a blunt injury, which is a sensation of the composite family. However, the patient during the interview has mentioned about a sudden unexpected blow or attack from behind, which Dr. Borkar says indicates the umbelliferae family. The patient is considered by Dr. Borkar to be of a compromising nature and hence categorizes her in the psychosis miasm. Following Shankaran's schema, the remedy that comes up with these two coordinates, namely the psychosis miasm and the umbellifera family, there is only one remedy, which is asafoetida. Continuing with Dr. Borkar's comments, Dr. Borkar gave this patient asafoetida and the condition in fact worsened. So he reconsidered the miasm and thought that the intermittent fever probably suggested the malarial miasm, and selected Sambul from the same family. Once again, there was no improvement, and in fact the condition was reportedly worsening. Therefore, he considered it to be a malarial miasm from the composite family in view of the bruised and beaten feeling. And the remedy that turns up, there were two remedies over there, out of which he chose one, and that remedy worked. I'm not telling you the name of that remedy now, because we will do an analysis by a traditional Bonninghausen method and try to see if we come anywhere close to it. Let me first emphasize that many classical practitioners, teachers and masters have always emphasized that the selected remedy's seat of action must correspond with the complaints of the patient. Here's what Bonninghausen has to say. Every medicine acts more decidedly on certain particular parts of the living organism. So what Bonninghausen is telling us, every remedy has got some particular affinity for an organ or a tissue. Burnett, one who was a very successful homeopath and did many deep pathological cases, and who was a doctor in England, has this to say. Given drugs affect given organs or parts by self-elective preference. In other words, every drug has got a certain affinity for a certain organ or tissue, and why it is so, we don't know. It is just a self-elective preference. That's the way it is. Another master, William Borike, has this to say. Every drug affects some organ or system of organs or tissue or region more decidedly than others. This is not a local action, but it's a localization of the drug's specific nature. So remember, all these people are pointing to one thing, that no matter which remedy you select, by whatever means or method, please make sure that the tissue or the organ is in fact related to, or the remedy has an affinity to that particular tissue, organ or system. Please keep this in mind, because this is a very important feature which can often lead to the wrong choice of a remedy, no matter which method you follow. Now, if we just refer to Boger's book, The Synoptic, and we look at the regions which are affected by asafoetida and Sambul, asafoetida has got relationships with the mind, and in bold letters the gullet, digestive tract and the periosteum, none of which actually happen to occur in this particular case. Also, it relates to ears, nose, tibia and the left side. Once again, we don't find any such thing in this case. Regarding the remedy that was the second remedy selected by Dr. Borkar, it has got affinities for nerves, the heart and the left side. Now, the second remedy is of course a much smaller one, but even so, it does not correspond to the complaints of the patient. Also remember that while a study of remedies on the basis of families helps, we have sufficient literature which shows that this cannot be carried too far. Let us see what Hahnemann himself had to say on family relations. In his lesser writings, he mentions, perhaps, however, botanical affinity may allow us to infer a similarity of action. He is asking this question. This is far from being the case, as there are many examples of opposite or at least very different powers in one and the same family of plants. Therefore, we come to the conclusion that it cannot be considered as a sure principle to guide us to the knowledge of medicinal powers of plants. Further, in the same essay, Hahnemann gives various examples of the compositive family and the umbellifera family and how one can be misguided by just thinking about relationship of remedies on the basis of family alone. So please be very careful. It may be helpful to remember certain characteristics of families, but please don't make the mistake of taking that as a gospel truth. In fact, I will encourage you to please read this essay written by Hahnemann in his lesser writings. This is an essay on a new principle for ascertaining the curative powers of drugs with a few glances at those hitherto employed. Here is a summary of the points that were covered in this particular video. First of all, we had a look at the presenting symptoms of the patient. And then we saw Dr. Borker's comments. Importantly, Dr. Borker said that this case may not be amenable to repertorial analysis, and therefore he employed, according to his wise judgment, the sensation method. Further, he used two remedies which did not work, and then finally he used a third remedy on the basis of family relationships and Shankaran's schema. Importantly, we saw the importance of the seat of action of any remedy that is chosen for any case, regardless of the method that one chooses to employ. We also saw what families mean and what were the observations of Hahnemann himself in being careful about using families during your analysis and synthesis of the case. Now, next video will tell us more information about what exactly we mean by the term systemic lupus erythematosus and whether or not this case qualifies to be labeled with that particular term. Also, we'll try to see if the selected remedies related to the affected tissue or organ and what were the shortcomings during case taking. So thank you very much for your attention and see you soon. Bye bye.